Good morning, it's 8 o'clock on Wednesday the 1st of July. The headlines this morning: thousands of job losses have been announced by a company which runs cafes and sandwich shops at railway stations and airports. Doctors and public health officials are calling on the government to move more rapidly in providing local councils with detailed data on potential spikes in coronavirus. The BBC News is read this morning by Zeb Soanes.
In the past hour, the company which owns the Upper Crust and Café Tazza food outlets has announced it's to cut 5,000 jobs because of the fall in passenger numbers at railway stations and airports caused by the coronavirus pandemic. Earlier, Airbus said it would shed 1,700 jobs at its commercial aircraft plants at Broughton in North Wales and Filton in Bristol. The Welsh Government and the Unite Union both described the news as devastating. Here's our business correspondent, Dominic O'Connell.
The food retailer SSP specialises in fast food at railway stations and airports across the country. Its chief executive, Simon Smith, said that the pandemic had had an unprecedented impact on travel and that early plans to reopen some outlets had been revisited. It now thinks, even with the easing of lockdown and the likely opening of air bridges, that only 1/5 of its outlets will be open by autumn. The job cuts will come across its UK operations and at head office. Airbus is cutting 1,700 jobs in the UK, with 10,000 going in France and Germany. Several other big companies, including Centrica, Rolls-Royce and British Airways, have already announced tens of thousands of job losses because of the pandemic. The job losses come despite the Bank of England's chief economist Andy Haldane saying there were signs that the economy was recovering more quickly than expected. Mr Haldane said official numbers showing big falls in economic activity so far this year were ancient history, and warned that it was even possible that inflation, which has been low for some years, could rise.
The government is under pressure to act more quickly to provide local councils with data about potential spikes in coronavirus cases in their areas. Some directors of public health say they're not getting detailed and up-to-date information about local outbreaks, such as individual addresses and workplaces. The Doctors' Union, the British Medical Association, says it's vital that councils are given more information so they can act swiftly. Yesterday, Leicester became the first city in the UK to be put under a local lockdown. Here's our health correspondent, Richard Gulpin.
It was back on June the 8th that the first sign emerged of a coronavirus outbreak in Leicester. But the city's mayor, Peter Salisbury, has said it was several weeks before the government provided the data from coronavirus tests to enable the local authorities to work out if there was an issue in the city, and if so, where it was. The head of the British Medical Association, Dr. Chand Nagpal, said having the most accurate and up-to-date data was crucial. It enabled swift action to protect lives, which was particularly important as the test and trace app was not in place. A government spokesperson insisted they'd been working closely with their local partners, providing the resources and tools they needed to take swift action to deal with any new local spikes in infections.
36 suburbs in Australia's second biggest city, Melbourne, are to go back into lockdown later today. The authorities say they've identified an unacceptably high number of infections there in the past few days. From Sydney, here's Phil Mercer.
The Victorian Premier Daniel Andrews is warning that the pandemic won't be over for a long time. He's blamed failures in the hotel quarantine system for Australian travellers returning from overseas for many new COVID-19 cases. More than 300,000 people in Melbourne will face restrictions when dozens of suburbs are once again placed into lockdown. They face fines of up to £900 if they leave home without a good reason. Residents from those virus hotspots are also banned from crossing the state border into New South Wales. If they do, they could face heavy penalties, including up to 6 months in prison.
The United States has struck what its Department of Health has described as an amazing deal to buy almost the entire global supply of a drug proven to be effective against coronavirus.